happening in psoriasis. You have dysregulated T cell activation, specifically Th17 and Th1 lymphocytes are hyperactivating. The T cells have lost control. There's insufficient IL-10 and TGF-beta signaling, which are the brakes of your immune system. So without them, your immune cells are just standing on the skinny pedal. So now those keratinocytes, the cells that make up about 95% of your epidermis, go from their normal 28-day life cycle to a 3 to 4 day life cycle. The skin can't shed them properly, so they pile up, and now you've got psoriatic plaques. This is a signal from a broken system. 2019 Journal of Allergy and Clinical Immunology showed psoriasis patients have significantly elevated CRP, TNF-alpha, and IL-6 in their blood, not just at skin lesion sites. This means your entire vascular system is dealing with chronic inflammation. Your endothelium, which is the lining of your blood vessels, is constantly exposed to inflammatory mediators. And the inflammation extends to joints, organs, nervous system, everywhere. The immune system is at the center of this entire mess. First, the barrier is broken. Your skin barrier is made up of lipids and tight junction proteins. In psoriasis, ceramide levels are tanked and tight junction proteins are downregulated. So you get this increased penetration of lipopolysaccharides and pathogenic organisms. 2019 microbiome proved you don't have the normal protective bacteria that produce short-chain fatty acids and anti-inflammatory metabolites. Second, you're on fire. Inflammation. 2021 Journal of the American Academy of Dermatology proved in psoriasis you have NLRP3 inflammasome overactivation. Now listen, the NLRP3 inflammasome is like a security alarm. It cranks out IL-1 beta and IL-18, two of the most potent pro-inflammatory cytokines you've got. Third, the adaptive immune system is dysregulated. The dendritic cells, the command center of your adaptive immunity, are presenting antigen in a way that promotes Th17 differentiation instead of Treg differentiation. Remember, Treg are the brakes. Your immune system interprets the inflammatory, insulin-resistant, low-energy barrier dysfunction as a state of infection, and it goes DEFCON 1 and produces Th17 cells as a defensive strategy. The sympathetic nervous system is in overdrive. So now you pump out norepinephrine and stress hormones. Chronic norepinephrine on immune cells amplifies their inflammatory response. But it gets worse. Skin has sensory nerves that detect inflammatory mediators. When these are activated chronically, they send signals to your brain to literally have a neural loop that reinforces skin inflammation, which is why patients always talk about constant itching and pain and why scratching pours gasoline on this entire fire. Comment skin for the